It is about a middle-aged woman whom I was treating then for another reason and whom I had accompanied for many years with occasional visits. Therefore, I knew her story. A single mother, at a time when this was socially reprehensible, at least in Spain, in addition to raising her son, this woman, who worked as a maid, had made the effort to study nursing, to pass the opposition and start working in a hospital. In addition, she took care of her elderly parents. And it was in the period of her life in which her son, who lived with a girl, had already become independent, that she came to see me one day for coccygodynia, that is, pain in the coccyx. For several days and for no apparent reason. I asked her whether she had hit herself or if she had fallen sitting down, which is the most typical. But no, the pain had appeared spontaneously. It missed me, that unmotivated, sudden and persistent pain. So I asked her, "Is there something that is affecting you?" Her response was, "Well, my son has had a fight with his girlfriend." And I thought, so what? Therefore, I insisted, "But how does that affect you?" Then she told me, "Deep down, I am afraid that he might come home to live with me, and I'll have to take care of him again." Then I mentally reproduced this woman's story, how much social effort, strength, support, an archetypal masculine function she had had to exert in her life, with her motherhood, work, and parents in the absence of a man by her side. You see, all this is adding load. And now she suddenly found herself faced with the possibility that her son might return, which meant even more work for her. And it was just in this precise context that her pain in the coccyx had appeared. Du Mai 1, an acupoint between the anus and the coccyx, came to my mind because, apart from its psychological resonances, due to the fact that it is the Du Mai creative point, that is, the one promoting its intrinsic functions, is well known for treating Coccygodynia. After the isolated Du Mai 1 puncture, she came the following week. Not only was the pain completely gone, but regarding the same situation, she was much more relaxed. Finally, her son did not return to live with her because he arranged his relationship with his girlfriend. I encourage you to try a single point for reasons I'll discuss later. Too much noise is generated if you add other points. Therefore, it is much more powerful to puncture it alone. I know, at first, it may bring about some worry for the patient. In fact, the first times I began trying the single acupoint approach, I used to tell my patients, "I'm going to try something new, but if it doesn't work for you, come back. I won't charge you for the next visit, and I'll give you a more standard treatment." I think that approaching it in this way can give you peace of mind to do a test with a patient. And please allow me to give you another piece of advice. Whenever attempting a single point, do not explain to the patient what result you are trying to achieve. Because first, you shan't be conditioning their feedback. Second, because if it works, it is interesting to hear them explain the effect in their own words. It is about their own experience they're talking about, and this enriches your vision of the attempted acupoint. Although Du Mai's creative point, that is, the one that activates its Qi, allowing it to display its archetypal functions, is Du Mai 1, there are occasions in which, due to its clinical indications, another point of the meridian seems to be more suitable. This being the case, I always start with trying it. Many years ago, I had a patient who I treated after having treated his wife. It was very clear to me that at home it was the woman who wore the pants, in all aspects. The reason for consultation was low back pain and insomnia. When I asked him about the characteristics of insomnia, it turned out that he couldn't sleep because he and his wife slept in a 1.35 m bed. She used to move a lot along the night, and he was constantly waking up. And I told him, but this is not insomnia, it is a logistical problem you've got. To which he replied, my wife does not want to change beds. Can't you fit a bigger one in the room? I insisted. And again, yes, but she doesn't want to. So it wasn't a problem of financial means. The lady had stood up and had said that no new bed was to be bought. Faced with his low back pain and such lack of personal affirmation of who I am and what I want, and taking into account that this individual was very cold, very chilly, I stimulated Du Mai 4, a known point of Du Mai that tones kidney yang. The next day, not only did he come without low back pain, but also he had gone to a department store to buy a 6-foot bed. I saw him again after 1 month. He told me, yes, the bed is very good, but my wife does not want to buy new sheets. So they were sleeping with individual sheets in the new double bed. So I suggested, well, maybe you'll finish the work right. I discharged him very quickly because he stopped having a low back pain and insomnia. This is certainly an anecdotal case, but it serves well as a sample of how to cross data to find the point where certain pathology can resonate in a specific patient.